My name is Megan Grilio. I'm one of the obstetricians and gynecologists at Tanner Healthcare for Women. And we're here today to try to answer some of the questions that we have recently been receiving regarding COVID-19 in our community. We don't pretend to know all the answers to the pandemic, and certainly we'll be happy to answer any specific questions you have about your management plan and would welcome those calls at any time. In addition to following all the CDC recommendations regarding cleaning and maintaining separation, we are only allowing very limited visitors in our office right now. Generally, we are allowing visitors during your first ultrasound to confirm your pregnancy, and then during your ultrasound for your anatomy scan to look at your baby's development. At the hospital, our policy throughout this pandemic has been to allow one support person to remain with you through your entire hospital stay of delivering your child. We understand this is a difficult request to make, that there are hopefully a community of support people around you during this time, but in order to limit the exposure to other moms, to other babies, other family members, our staff, we are asking that we continue to limit that support person to one visitor per patient. As many of you probably know, and another thing that we commonly get questioned on is we are, for the last approximately 1 month now, we have implemented universal testing. This means that if you are having a scheduled C-section performed, you would be tested 2 to 3 days in advance of that C-section. If you're not having a scheduled C-section, we would perform that testing at time of admission to labor and delivery. We understand this nasal swab is not comfortable. The truth is many parts of prenatal care and bringing a child into the world are not comfortable. But the reason for this testing is so that we can keep you as a new mother, your newborn, and the community around you just as safe as we possibly can. So if those test results are negative, we would still implement the same precautions that the CDC is recommending. We are still going to limit visitors into the hospital during your stay. We are still going to encourage use of masks throughout your hospital stay. Your visitor will still be screened to make sure that they're not displaying any symptoms, and you'll be monitored closely for the development of any symptoms. We will still encourage hand hygiene. We will still encourage all of those measures. If your result is positive, there are additional measures that we would put into place or that we would recommend at that time. Now, those measures do not include separating you from your newborn baby. The only time that would be recommended is if your baby is critically ill and requires care in our neonatal intensive care unit, or if you become critically ill and can no longer safely participate in the care of your newborn child. What we would recommend if you test positive is that there is some degree, even though your baby will be in the room with you, that we would maintain some degree of separation between you and your newborn child when you are not directly participating in your newborn's care. When you are directly participating in your newborn's care, which you certainly encourage as a new mom, we would again ask you to wash your hands prior to that, to wear a mask throughout that direct contact with your newborn, and to wash your hands afterwards. We know the most likely way for a newborn baby to become ill with COVID-19, just like with children and adults, is through respiratory droplets. And so we want to do all we can to minimize that newborn baby from being exposed to any respiratory droplets that could contain the COVID-19 virus. So an additional question that we often get asked is it safe to work at this time? So generally, we encourage women to be active active, to still participate in their regular lives throughout their pregnancy, unless specific restrictions are required based on your medical conditions. And that is still true now, with the caveat that your employer needs to be following the CDC recommendations to allow your workplace to be a safe environment for you. Working from home is an option with many employers, but if it's not an option, they should be allowing social distancing and encouraging the use of masks anytime that you are within 6 feet of a coworker. Pregnant women could in fact be at higher risk for becoming severely ill with COVID-19 compared to other women of a similar age and with similar medical problems who are not pregnant. What the study showed was an increased risk of becoming hospitalized, requiring admission to the ICU, and requiring mechanical ventilation, meaning the breathing tube becoming necessary for those women. Because of these concerns, as well as the concern for possible transmission to a newborn baby after delivery, we are just encouraging our patients to be even more vigilant about following those CDC recommendations during their everyday life. That means socially distancing, that means frequent hand washing, that means consistently wearing a mask when in public places. Tanner has continued to provide community updates on the current status of COVID-19 in the Carroll County area. We encourage you to visit the website, learn about the current status with the information provided there. At this point, we are seeing that our community has been hit hard by this, and we want to make sure that we're doing all that we possibly can to keep our community safe, to keep you as a soon-to-be new mother safe, and your newborn babies as safe as we possibly can during this time. If at any point you develop symptoms concerning for COVID-19, you have been exposed to someone who was positive for COVID-19, or you have any questions regarding this pandemic, please contact our office. We are here for you and are excited to celebrate this new chapter of your life and this new life that you're bringing into the world despite these difficult circumstances.